It can be difficult helping a patient decide which vaccine is best for them. For some vaccines, such as the shingles vaccine, there is only one product that is recommended. That makes it easy. However, other vaccines like the COVID-19 and flu vaccines are available as several products that have different indications, different serotypes, and are made from different manufacturers. This can confuse patients about which vaccine is best for them. And just like with any other medication, there may be certain properties about the vaccine or the patient that make a specific vaccine better for an individual. Individuals within the community play a vital role in encouraging others to stay up to date with their vaccinations, and healthcare providers can assist patients in navigating through complicated information to pick an appropriate vaccine. When patients ask about the difference between certain vaccine products or ask which vaccine product they should get, you may want to begin the conversation by asking permission to verify some information. It's important to let the patient know why you are asking this information. We cannot and should not assume that everyone automatically understands why this information can be helpful to the conversation. Some vaccine products have specific recommendations for patients of a certain age, such as flu vaccines, or have certain ingredients that the patient is allergic to that should then be avoided. After assessing relevant patient-specific information, verify which specific vaccines the patient is due to receive and if they intend to get these vaccinations at this visit. When discussing the topic with a patient, identify which vaccines the patient could and should receive. For some patients who could receive multiple vaccines, the information could be overwhelming, and their first instinct may be to avoid getting any immunizations. To prevent this, inform the patient what broad categories of vaccines they are eligible for, and then acknowledge that it may feel like a lot and recognize that they may be overwhelmed. Although we may prefer that they receive every vaccine that they qualify for, remember getting any vaccine is better than no vaccines. It may help to reduce the burden on the patient by helping them understand that it does not have to be an all or nothing approach. You can inform them that they can receive all the vaccines, but that they can also receive just a few and obtain the rest later. You can provide autonomy to the patient with simple questions such as, which vaccines were you thinking about getting? This avoids putting pressure on the individual to receive all their indicated vaccines, but still advocates for immunization. When the patient elects to receive all or any vaccine, provide support for their decision and reinforce your appreciation for the trust that they have put in you. After gathering more information from the patient and determining which vaccines they're interested in receiving, you can begin to differentiate the available products. When having this discussion, make sure to relay the information in a succinct way to prevent any confusion from the patient, as there are countless products for some vaccines which can be confusing. You can start by informing the patient of some basic differences between the majority of vaccines. Vaccine composition may be important to some patients. These may be more obvious, such as the vaccine which are grown in eggs, or more subtle, such as certain preservatives or stabilizers within the vaccine. If the patient has an allergy to one of these elements or possesses certain lifestyle or cultural backgrounds that affect their ability or willingness to receive vaccines with specific components, inform the patient that there are other options for them for most vaccines. This is important. Many patients have been told not to receive certain vaccines because of their need or wish to avoid specific components and are unaware that viable alternatives may be available. For example, if a patient tells you that they cannot receive the flu shot because they're allergic to eggs, you can tell the patient there are newer egg-free vaccines that are available. So you can receive vaccines such as the flu shot without worry about reacting to the egg component or violating your beliefs. Sometimes certain vaccine properties are known to be better in specific patient populations. It is important to avoid making it seem as if those particular versions are preferred in every patient. It is best to use phrases such as, all flu vaccines help protect you from the flu, but if you're 65 years or older, there are certain products specifically for you. This informs the patient about the different products while reinforcing the idea that all vaccine products are efficacious. Patients may find other factors important when selecting vaccines. The number of doses required, how the vaccine is administered, potential for side effects, interactions with medications the patient is taking, and vaccine design are just some of the influencers of vaccine choice that should be considered. It is equally important that patients recognize that you only advocate vaccines when indicated. One of the myths circulating is that all vaccines are pushed for everyone, but that is not true. And if patients know that you only advocate for a vaccine when it really is needed, they are more likely to see you as an advocate for their health and not an advocate for vaccine sales. For example, older adults require more vaccines in general because immunity has been shown to wane over time. Although someone may have received a vaccine in the past, they may need additional doses over the years to keep their immunity at optimal levels. Explaining the rationale behind the additional doses allows the patient to make the connection the vaccine continues to play in their ongoing health. At other times, newer versions of vaccines may become available that provide protections that older versions do not. It is helpful to ensure patients understand that these newer versions bring opportunities for protection that they have not yet been given. For example, new versions of the pneumococcal vaccine have recently become available. Taking the time to explain the differences between the older vaccines and the newer vaccines allows the patient to determine what benefits the vaccine offered them. Regardless of which vaccine product the patient is asking about, always make sure the patient understands that each product is effective and that they all have similar side effect profiles. Medications and vaccines are often made by different manufacturers. Although this is not a new practice for vaccines, public awareness increased significantly with the introduction of the COVID-19 vaccines. For some patients, it may have been the first time they realized that they had options when it came to vaccinations. Let's use the COVID-19 vaccines as an example for helping patients select when multiple manufacturers have available products. When discussing this, avoid biased conversation. You can relay this information by stating, all available vaccines are proven to be efficacious and no products contain eggs, preservatives, or fetal cells. However, the timing of when you need to come back for the follow-up shots is different. The patient may also want to know the specific side effects for each vaccine that may pertain to them. You can inform the patient that the different COVID-19 vaccines have some rare risks associated with them, just as every other medication on the market, including some they may already be taking. It's important to make sure patients understand that while the risks exist, they don't happen in every patient. It also is important that they know that not every vaccine version has the same risks or level of risk. For example, the mRNA COVID-19 vaccines have caused myocarditis, which is the inflammation of the heart, and pericarditis, which is the swelling of the tissue around the heart, in a small number of patients. These are mostly seen in teens and young adult males within 7 days of receiving the vaccine. If a patient appears very concerned about this risk, encouraging the use of a non-mRNA vaccine may reduce their reluctance towards immunization. It also allows the patient to see that you have their best interests at heart. For further information, you can suggest the patient look into credible resources to investigate the detailed differences between the vaccines. If you are willing, you can also share your experiences both in administering or receiving a particular vaccine. The A Shot for Alabama website, available at ashotforalabama.com, has a variety of resources that can help the patient select the best vaccine for themselves in an honest and objective way. It's best to reinforce the idea of autonomy to the patient while discussing differences in vaccine formulations. Although you may personally recommend one product over another to a patient, explain to the patient that it is always their decision on which product to receive. You can make this clear to the patient by saying, regardless of this information, it is always your choice which product you decide to receive. Some vaccines should be avoided or used in certain patients based on their allergies and age, but with several products, it really comes down to your preference. By removing this pressure, the decision on vaccination becomes the patient's and increases their confidence in the overall role of immunizations in their healthcare. Anytime you provide a person with information, allow them an opportunity to ask clarifying questions or to bring up topics of concern. This is a useful tactic when trying to determine if the patient felt overwhelmed and confused by the conversation, or if this helped them narrow down their options. You can ask the patient, "Did this information help narrow it down for you? I know it can be very confusing with so many products available. Always end the conversation by letting the patient know they can reach out with any additional questions that they may have. Together, we can help reduce the burden of vaccine-preventable diseases in our communities. For more information, please visit the A Shot for Alabama webpage at ashotforalabama.com.